live streaming. Um, just like we all know, for those who have been following us on this particular channel, this is Healthy Living Global channel, and Healthy Living Global is focused on health promotion, disease prevention, creating of awareness, working hand in hand with both the healthcare providers and also healthcare consumers. Let's see how we can be able to achieve this goal of healthy living, all right, in a global scale. So, welcome to this live streaming. Welcome around to tell us where you're watching us from, and even your name if possible. All right. So today we titled today's topic "Everything to Know About Vaccination." Everything to know about vaccination. Sorry, we have had a lot of um, distractions all this while since we started the discussion on vaccination, which was not funny anyway, but we keep pushing it to see how we can just maneuver some obstacles that is coming as a result of this live streaming, which recently we had that of power supply challenge. So, but today, I believe today will be better. So, today we are discussing what everything to know about vaccination. If you can stay till the end of this video, you should be able to have at least 80% of ideas on how vaccination works and how you are expected to be vaccinated, so that even your children, right, even your babies, they are expected to be vaccinated to make sure that they are immunized, they are protected from all these bacteria, virus that may try to invade their system. So, which the emphasis is on what prevention measures, right? Which we say that prevention is cheaper than cure. All these things we are going to mention today in this live streaming. Many of all the diseases is difficult to treat. Many of them can be very challenging, right? But with this vaccination, you can be able to prevent them. There is a lot of myths associated with this vaccination. That what we start with today. People say that when you receive vaccination, right, that they introduce the disease into your body. Even if you don't have the disease before, you now start developing the disease. It's not true, right? What does vaccination do? When they are vaccinating you, they use what we call live attenuated, weakened version of a particular disease. They introduce it to your body, and your body develop antibody against it, so that whenever it comes, your body can deal with it. Right? With that particular weakened version cannot result to a disease in your body. No, it will only help the immune system to have the record of that disease and be able to fight it whenever it comes. So, by vaccination doesn't mean the disease have been introduced into your body so that it will start developing or it will start harming you. No. All right. So please let us understand it clearly. It's not a harmful thing to introduce this live attenuated, right, version of this vaccine. So those are the myths associated with this vaccine. And another might again, people feel that with this vaccine is going to decrease their immune system, or is going to bring down their immune system. So they prefer let them face the challenge itself, since we say that whenever someone have a health challenge, the immune system is going to save the record of that, just like vaccination, or it's going to save a record of that particular disease the person have fought before and be able to fight it next time. That is better to use that particular natural way. But we are saying that when it comes to this vaccination, it is better because all those ones will limit all this hospitalization taking you to hospital, all these issues. And there's some disease that when it's introduced into the body, all right, that is, if it's not vaccinated, it comes into your body. There is no how, you cannot even prevent it anymore. The only thing is just management. All right, there is some of them that are not curable or reversible. So all these things is something we need to take note of when it comes to vaccination. There are the mites that are associated with this vaccination. So vaccination is good for a long time now. It has protected a lot of people from different challenges, from different illness. All right, it has protected us and helped us to overcome diseases like polio, like even yellow fever, all these hemophilus influenza, all these pertussis, whooping cough, all right, which you see pertussis, right? Even all the diphtheria. So all those issues have become was deadly before now, all right, but now, as it stands now, these prevention measures using vaccination have reduced it to a large extent. You rarely see where they say this one have polio. No, all right. You cannot just say, unless maybe in the far north where they are not taking this vaccination too serious. And another thing again, might that people not always have is that when they inject you, that particular, that with these vaccines, that is going to cause paralysis or going to make you not to walk again, all right, just like some videos have shown or people are bringing proof. The truth of the matter is that even aside vaccines, all right, if a health worker did not administer the injection as expected, all right, at the gluteus muscle, the upper right or left quadrant, it cannot be safe for that patient. You see that what the patient may still develop something like abscess, or if he injures any of the vein or blood vessel around that area, it can lead to still the same paralysis. It doesn't mean that is the vaccine, all right, that is doing that. So vaccine is not um, a bad thing. Vaccine is always something that we need to uphold because it have helped us a lot and helped in preventing many health challenges. Now, um, let us begin to discuss them one after the other. All right, let us begin to discuss them one after the other. These vaccines and their uses. All right, let us just do a recap from what we discussed yesterday, then move it down to that of the one teenagers and adults can receive, and also have the one for special cases. All right, when it comes to childhood vaccination, all right, we have something like BCG. All right, BCG is a vaccine that is used to prevent tuberculosis. Which tuberculosis is deadly. Tuberculosis have dealt with a lot of people. Before now, tuberculosis have taken a lot of lives. But since the introduction of this vaccination of tuberculosis, the death record have reduced drastically. So this BCG have helped what in dealing with tuberculosis. So it's given at birth or few days after birth, this BCG, to protect someone from what having tuberculosis. The next one is hepatitis B. Of course, we know what hepatitis B is all about, right? Which is capable of causing liver damage or even liver cancer. So by vaccinating yourself of this hepatitis B, like in that of babies and even in that of adults, vaccinating yourself of hepatitis B help in protecting your liver to a large extent. Before I continue, um, there's something I'm going to mention again when it comes to all these mites associated with this vaccine. All right, there's something I'm going to mention. Now, before someone receive a vaccine, because this misconception of is when they give this injection, this vaccine into the body, they will now the thing will now develop into the body because the person was not having it before. No, it doesn't work that way. Before someone receive some vaccine, like especially that of hepatitis B, All right, before you receive the vaccine, you must make sure that you check yourself thoroughly and you are not having this hepatitis B, especially that of adult. Before you receive it, you must make sure you don't have hepatitis B, because if you have it already, by introducing this vaccine, it is going to worsen your condition. It will make you to be worse because you have it already. In fact, it's very deadly for you to introduce the hepatitis B vaccine in adults if you have it already. So, which is the reason we always encourage, do a thorough checkup and make sure you are not having hepatitis B, then go and receive the vaccine for 3 consecutive months. Or that is once every month for 3 consecutive months. If you just do it, that is all right. You know that what you are protected from the hepatitis B. So back to what we are discussing. Remember, we are still in childhood vaccinations. The one you can receive in childhood. You say number one is BCG, all right, that prevent tuberculosis. Of course, tuberculosis is a chronic respiratory tract infection that is able to kill someone. All right, it's very deadly. So it prevent this tuberculosis. Number two that I mentioned is this hepatitis B. Of course, hepatitis B is very good and it can protect someone. That hepatitis B vaccine is very good and it can protect someone from having hepatitis B, especially that of babies, all right, at this stage, which is in the childhood vaccination section. So all those things will help and protect the baby's liver and make sure that what the baby do not have this hepatitis B. You know, a lot of people will come, I want to carry your baby, I want to do this, I want to do that, and before you know it, many things can happen, of which they can actually transmit any of all those disease of that nature to your baby. So you need to take your baby to be vaccinated or hepatitis B. Another thing is what we call PCV, pneumococcal conjugate vaccine. Pneumococcal conjugate vaccine for what? Vaccination against pneumonia, all right? That what we call pneumonia meningitis, all right? So this pneumonia that is caused by pneumococcus, all right, that is capable of causing meningitis, it protects a child from having this pneumonia meningitis. So pneumococcal conjugate vaccine is very important in babies and it protects them from this deadly disease. All right, it's a bacterial infection. Once someone is vaccinated, baby is vaccinated, it protects the baby from all those things. Now, another thing under childhood vaccination, which is number 4 under childhood vaccination, is what we call Penta vaccine. Penta vaccine it contains 5 different things. All right, Penta contain vaccine for whooping cough. All right, whooping cough is what we call pertussis. All right, that's what we another name for whooping cough. Pertussis is a very strong bacterial infection. It protects someone also from this Haemophilus influenza. All right, that influenza B. It protects someone from hepatitis B. It protects someone also from tetanus, and it protects someone from diphtheria. All right, 5 things that it can be able to protect someone from this penta vaccine. So, which is the reason we encourage every baby, all right, or maybe parents that are having babies, take your baby to the healthcare center to be vaccinated of all these things. All right, guys, sorry for the interruption. This is different vaccines, right, that can be used with BCG. We mentioned that of hepatitis B. We mentioned of that of PCV and Penta, right? Now, another thing which is number 5 that we are going to discuss again is what we call OPV and IPV. OPV is called oral polio vaccine and IPV is called inactivated polio vaccine. All right, this particular vaccine all is used for what? To fight against polio, to prevent polio. All right, of course, before now polio have dealt with a lot of Nigerians, especially children. If you go to the far north, you see people that are having polio that are paralyzed because of what polio case. But people that have followed this these vaccinations, all right, squarely followed it without missing any dose, you discover that it's very difficult for their baby to have polio. So vaccine have helped us. Vaccine have helped us. So this OPV and IPV is used for prevention of polio. Please take note. That is number called rotavirus vaccine is used to prevent rotavirus, and rotavirus have taken a lot of lives, all right, especially that of babies. That is what causes this infant diarrhea, right? You see a child having diarrhea, vomiting, and everything. Before you know it, the child become dehydrated, and before you know, the child will die. So this rotavirus is very deadly and dangerous. I've witnessed one of which, had it been there is no supportive care and a kind of strategic interventions, it would have been a very fatal one, right? Of this case of rotavirus issues, all right? So it's better to prevent it. It's the major cause of infant diarrhea, all right? And it's very deadly. So rotavirus can be prevented with rotavirus vaccine, and you can receive it in the health center, all right? In all this normal vaccination schedule for childhood. Now, which is number 6? Number 7 is what we call MMR, measles, mumps, rubella vaccine. Of course, measles are very common. It's a viral infection, right? It's a viral infection. That or mump also the same thing. Rubella. So all of them is something that can be prevented. All right, it can be prevented using this MMR. All right, those infections that are very contagious. Of course, we know the signs of mump. Mump is an infection in the salivary gland. All right, cheek region, you see this place will just swell up. All right, so that's how you notice the signs, and it's very contagious and also very dangerous for the infant. So that on measles, you notice it like all this rash all over the body. You see the person having a sinusitis, like all these catarrh, all those symptoms as if it's allergic reaction. Before you know, the person will be having fever and other issues. So measles, mumps, rubella is something that can be prevented using MMR vaccine. All right, they are very contagious, they are dangerous for the infant, and it can be prevented using MMR vaccine. All right, sometimes some group of health workers, especially the one powered by primary health center board, they sometimes can go about and do the campaign of vaccination of children around the community of this MMR. All right, whenever you see such a thing, even if you have received before, you can still receive for what? More protection. All right, very important that you can see avail your baby for that vaccination for what? More protection. Now, that one is number 7. Number 8 is what we call yellow fever. All right. Of course, yellow fever have also taken a lot of lives. What does it do? What does it destroy in the body? It damages the liver. All right. The yellow fever what damages the liver, and it can be prevented. All right, in childhood using yellow fever vaccine. So before now is very common, but recently no one actually knows that is even existing due to this invention of vaccination. So vaccination is very good. Vaccination is highly recommended. Take note. Another thing, number 9, is what we call meningitis A. All right, meningitis A prevent what we call meningococcal meningitis. All right, it prevent meningitis that is caused by what a bacterial infection. It's a particular bacterial infection which you call meningococcal, all right, meningitis. So that particular bacterial infection can be prevented using what we call meningitis A vaccine. It can be prevented and make sure that um, someone do not contract it, even when you are close to anyone that is having it, right? For babies, very, very important. Now, the next thing we are going to enter now or discuss about is what we call teens and adult vaccination. All right, the one that is recommended during teenager stage or even adult stage vaccination. So this other one have covered that of childhood. If you can be able to receive all these in the schedules, there is one for 2 weeks, there one for 4 weeks, and so no 2 weeks in the primary health center. That is scheduled for 2 weeks, that is scheduled for 6 weeks. That's how it keep going. Before you know it, it reaches I think 1 year 3 months, which is 15 months, right? That is the where that of a childhood vaccination stops, right? 1 year 3 months, which is what 15 months altogether. So this vaccination, if you are following it with devotion or squarely, following it consecutively as prescribed or as stated or as written in the card, the schedule, the appointment for your baby, you discover that what you'll be able to prevent all these issues that will have been mentioned, all the diseases will have been mentioning for your baby. They are capable of protecting your baby from all these things. They are very deadly. All these things we have mentioned are very contagious, and you can prevent them by going for this vaccination, please. Now, that of teenager and adult. Number one, we are going to mention them is what we call HPV, all right? Human papilloma virus. Yeah, human papilloma virus is highly recommended for for people for teenagers, right? Like that of 9 to 14 years of age is highly recommended for this age. Why? Because at this stage they are not that sexually active, because it's always transmitted through sexual intercourse. So when you vaccinate your child of this HPV, human papilloma virus, you protect your child from having this human papilloma virus. It's capable of causing warts, genital warts, is capable of causing cervical cancer and other cancers that are related to this human papilloma virus. So they are very dangerous, they are very contagious and very deadly. So at teenagers age, like that of 9 years upward, 9 to 14 years, let your child go and receive that particular vaccine, both male and female, please, both male and female. Emphasis has been on only only female because of cervical cancer, but please, both male and female should receive this vaccination of human papilloma. All right, very, very, very important. And also, if someone did not receive it on time, because expected to be 2 shots within the period, no, 3 shots within the period, which is the first month, then the other one is that is first shot, which is the zero, the first day, right? The next one will be in the next 1 to 2 months, then in 6 months. That of a child that is like 15, a teenager that is like 15 years can also receive, all right, maybe up to 3 or 4 doses, as the case may be. Then if someone did not receive it and you are reaching like 26 years of age, all right, that what we call catch-up dose, all right, for people that maybe they didn't receive it as prescribed, right? You understand? They didn't receive the full course of this vaccination. They can just use that to meet up. We call it what catch-up dose. They can just use it to protect themselves of this HPV. And even at um adult age, that is full grown adult age, like 30 above, 40 above, you can still receive it, you can still serve what as a protection. But one thing that we need to be aware about this HPV is that once someone contract this human papilloma virus, it is not reversible. is not treatable by the vaccine. So you can only do the one you can on time, which we say prevention is cheaper than cure. You do it on time, you save your life and save others around you, especially that of your partners. Now, that is number one we have mentioned under teenagers and adult vaccination, right? Which we say is what HPV vaccine. Number two is what we call tetanus booster, right? Tetanus booster vaccine is expected that everyone should be receiving tetanus booster vaccine every 10 years, and immediately after a serious injury. If you have like a very serious injury, you can receive this tetanus vaccine or be receiving it every 10 years for what protection. Tetanus is what causes what we call lockjaw. All right. The thing used to, in fact, when tetanus, someone is having tetanus, within space of minutes, all right, the person can die as a result of the tetanus. To lock the jaw, make the person to be a kind of, it will destroy the central nervous system, and before you know it, the person can go away at any time. So it's important that we go for this tetanus vaccination every 10 years or immediately after any serious injury. All right, very important to avoid this issue of tetanus. We have mentioned two, right, under this teenagers and adult vaccination. We mentioned that of HPV, or right, human papilloma virus, and I mentioned that of tetanus. The next thing is influenza vaccine. All right, this hemophilus, this one is influenza or cold, all right, of normal cold. All right, this particular one is received once in a year, especially where this flu are very common, right? In a country where there is issues with all this flu, before you know, you hear this other one is having a viral infection. Of course, rhinovirus, they are very good at that, right? Giving somebody back to back when it comes to all this flu, all right? So to protect yourself squarely from this particular issue of flu is important, especially in an area where it is endemic. All right, when we say area where it is common, right? So now you receive this once every year of this influenza vaccine. Very important. Now we have what we call COVID-19, all right, under these teenagers and the adult vaccine. COVID-19 vaccine, all right, it protects someone from what we call SARS-CoV-19, which causes what? COVID-19. So of course we know how the challenges behind this COVID-19, how it affects the respiratory tract. It have taken a lot of life. Since 2019, we have been having the challenge of this COVID-19, but I think with the intervention of the healthcare professionals and a lot of researchers, we have brought that to book. All right, it has been handled to a large extent. You rarely see or have any record of this COVID-19 case. All right, you don't hear it anymore because of it has been handled. So take note, it have vaccine that you can still receive for protection, all right, of this COVID-19. So that's it. The next one is what we call hepatitis A. All right, hepatitis A, which is transmitted through infected food. All right, is that why not as a result of blood contact or any blood, or maybe through sexual intercourse or something? No, hepatitis A is because of what unhygienic foods that you are eating. You can get hepatitis A from there. Of course, anything hepatitis goes down to what? The liver, and once your liver is destroyed, that is the end. So it can actually make you to die at any time. So hepatitis A vaccine is highly recommended to protect you from this hepatitis A. All right. So there's some certain countries where this hepatitis A is endemic. So it's actually important you vaccinate yourself so that if you are going, you can go with what with confidence that you are highly protected from all those issues. Anything you will eat, it's not something that will make you to contract this hepatitis A virus. So that is what you need to just make sure that what you protect yourself from that by taking hepatitis A vaccine. Now, Another thing we are going to mention, hepatitis B vaccine. It also have vaccine, hepatitis B, but that of C doesn't have vaccine, and that of E. All right, we have A, B, C, and E. So A and B have vaccine. Of course, we know how contagious this hepatitis B can be, even through contact with bodily fluid, mucous membrane, through blood, all right, mother to child, all right. It can be through sexual intercourse, use of the same needle, all right. So it can be transmitted in various ways, which is the reason we need to be very careful about that and tackle it on time. Please, from today, if you go to the health center for checkups and discover that you are not having any hepatitis B, we encourage you to proceed immediately and go and do some checkups and protect yourself of this hepatitis B. So very, very important, because it's very common in our society. It's very common, and once it invades your liver, before you know, it will begin to destroy the liver and take it down totally. So that is the challenge that we're having, and we need to handle that challenge with carefulness. Now, another thing we mentioned there is typhoid fever vaccine. Of course, it have a vaccine. This typhoid fever that we treat every day, it have a vaccine, even though it's not that common in our society or in many healthcare centers, but it have a vaccine which can protect someone to a very large extent. So, and I think this particular one is highly recommended in a country like Nigeria, where we treat typhoid and malaria almost every month. So at least that will help us and protect us from having these continuous typhoid issues. So please take note, you have what, a vaccine. Another thing we are going to mention is what, vaccines for special cases, which is the last part of our discussion in this live streaming. Vaccine for special cases. All right, there's some certain vaccine that are recommended for very special cases. Number one is what we call rabies vaccine, right? Rabies vaccine, which works against rabies, all right? Like after dog bite, all right, begin to have issues with rabies, all right? This particular rabies vaccine, or maybe we put, let's say, anti-rabies, all right, the one that works what, against rabies. Anti-rabies vaccine help what, in protecting you from rabies. So it's highly recommended from this rabies virus. It is recommended whenever you have let's say dog bite, you quickly go and receive what, this anti-rabies vaccine. In our communities, we see some local dogs that are around, all right. Sometimes you ask the owner how far about the dog, they will tell you the dog have been vaccinated, but of course the dog have not been vaccinated, all right. Which you need to be very careful. Prevention is always better and cheaper than cure. So whenever you have this rabies, where you have dog bite, quickly go to the health center and get yourself vaccinated. All right, go to the health center and get yourself vaccinated of anti-rabies vaccine to protect yourself from having this rabies. When rabies come, it is very dangerous and deadly. Before you know, it kind of destroy the central nervous system. Before you know, you see the person jerking, and within few minutes the person can actually die as well. The person will be barking like a dog, right? So there's a lot of things this rabies can cause. It will just destroy the general body, and once it starts, once rabies virus enters into the body, all right, maybe the dog that bite the person is having this rabies and transfer it into the body, and the thing go into the central nervous system and start its work. It's not reversible, all right. It's just to uh, give the person a supportive care to death, because it's very dangerous and deadly. It's very difficult to reverse that condition. So it's important that you do prevention measures, and the prevention you are going to do is to make sure that what you stay away from all these local dogs. In fact, stay away from dogs and other rodents, right? Even carnivorous animals around you, or which you think they are just okay. They are all those animals that are dangerous and deadly to your health. So especially that of local dogs, stay away from them, and also make sure that anytime you have any dog bite, go and take anti-rabies vaccine. Do that at once to avoid this issue from coming, because once rabies come, you cannot be able to handle the condition. All right, it's very dangerous and it's deadly, and at some point or some stage that this rabies issue will reach, even your money cannot reverse the condition. It's too deadly for us to neglect it. So please make sure that you protect yourself from this ugly situation by taking anti-rabies vaccine immediately after any dog bite, and also going away from all the local dogs as around you. Don't play with any of them, all right? Because even aside their bite, their saliva can have this particular this rabies, all right? It can have this rabies virus, this saliva, all right? That their saliva can have it. So maybe you are eating, you allow the dog to come and be eating with you, all right? Or maybe you have a wound, the dog will come and be licking the. All those things are something is not recommended, because it's capable of making you to have this rabies. So please take note of that, and protect yourself from all those things. We say prevention is always what better than cure, and is even cheaper than cure. So I've mentioned that for what special cases. This one is vaccination for special cases. We mentioned that of anti-rabies vaccine. Now another thing is what we call cholera vaccine for cholera. All right, when we hear of any outbreak, of course have happened before, when there's an outbreak of cholera, there will be vaccination of cholera to bring it down, or make sure that what the prevalence of that cholera is not going higher. All right, they will just reduce it to minimum and even eradicate it totally. So they have used this particular vaccine to fight this cholera for a very long period of time, and they have helped us a lot in recording lesser number of people that are having cholera in Nigeria. So cholera vaccination is very good, and it's for special case when there was cholera outbreak. Now we have what we call shingles vaccine. What is shingles? Shingles is a reactivated chicken pox. For instance, someone is having chicken pox after all these blisters and everything will go, and before you know it, there's some of them, so some of all these viral part of it that can still be in a tissue, and later it will be reactivated again, maybe at the age of 50. It's very common at the age of 50 and above. It will reactivate itself again, and before you know it, um, it will begin to give you a lot of signs, all right, a lot of patches in the body, which we call it shingles, all right. So this particular shingles can be prevented. It's an injection for vaccination for very special case. Once all these things is reactivated, it can be tackled immediately and make sure that it's brought down, or it can even be taken for what prevention measures to make sure that what you don't have these shingles. So it's for what very special case. The last one we're going to mention here is what we call pneumococcal vaccine, all right, that protects us from pneumonia, which is especially that of adults. Of course, I mentioned other areas, especially in that of childhood, all right, that we can use a pneumococcal conjugate vaccine, all right. We have even the one that painter that have this whooping cough, Haemophilus influenza, that deal with even pertussis and so on. All those ones covers that area, but still in adult, all right, that is having pneumonia, all right, or maybe to protect the adult from having pneumonia, you can use this pneumococcal conjugate, this pneumococcal vaccine, all right, especially where this pneumonia is endemic. So you can use it to protect yourself from having this pneumonia, all right, that is capable of transferring to other people around you, all right. That is very deadly. Of course, this pneumonia is caused by pneumococcus bacteria. So, and is very deadly and is dangerous. So that is what we are going to discuss now. What are the benefits of these vaccines? What are the benefits of these vaccines? Of course, vaccine have a very important benefit because one, it stops the spread of infection. When you vaccinate yourself, you have ended up what cutting down the chain of this of the prevalence or the spread of infections, especially that of communicable contagious diseases. So let's say for instance someone's supposed to contract it from you. If you contract from this one will contract it from you. If you get yourself vaccinated, you cut off the chain. All right, you cut off the chain so that if this one comes, it cannot infect you and you cannot even transfer it to someone else. So by this vaccination, it have helped what in making sure that what it cut off the chain of transmission of infections. All right, so vaccination. Number two, vaccination have helped what in reducing hospitalizations. All right, like taking someone to the healthcare center. All right, say this one is sick, this one is different critical conditions in the hospital have been reduced because of vaccination. Of course, before now, a lot of people visit the healthcare center, they visit hospital due to this case, due to that case, all right? But because of this vaccination campaign and people that are buying this idea of vaccination campaign, going for vaccination, it have reduced a lot of issues, have prevented all these issues from coming. Just like for instance now, someone that may develop liver issue, all right, like that of hepatitis. So if you vaccinate yourself or hepatitis B, you see that you have ended up what preventing that hepatitis B, and uh, the the visit that you're expected to go and be visiting hospital to make sure you treat hepatitis B, or even make sure you uh, deal with the symptoms and everything, it will reduce that. It won't be necessary anymore because of what vaccination. All right, vaccination have helped in achieving that. Now, another thing, vaccination protects you and even those around you. All right, it protects you as a human and even those around you. That's another advantage of vaccination. Another number four, vaccination helps what in reducing the healthcare burden of the public health. All right, when it comes to public health, when there is enough vaccination, it will reduce what the healthcare burden. Before you know it, even the money that governments are spending to make sure that what people live a healthier life, it will be reduced. It will reduce even the funding or the budgets of the healthcare. If the people in charge can be sincere enough, it will help what in cutting down the money that is supposed to be spent on all this attacking of all those issues. All right, so it's very important. Now, number five, vaccination is cost effective. Let me take it again. I say number four, vaccination is cost effective. What I mean is that what the vaccination is just like saying vaccination is very cheaper, right? It's cheaper because okay, there's some that receive free, which we know, but there's some that you receive with money. Like there's some certain healthcare centers that if you are receiving hepatitis B vaccine, you need to pay for it, right? You need to pay for it. When I received mine in a particular healthcare center, for 3 consecutive months, once in a month for 3 consecutive months, I paid 2,005 per month for 3 consecutive months, and the total is 7,005. If you are to be treating hepatitis B, all right, that 7,005 cannot buy anything. It cannot buy anything. So the 7,005 is just a change as compared to money that are used in treating liver problems caused by what hepatitis B. So which can even result to liver cancer. Once it result to cancer, issue has come. All right, so which is the reason we need to be very careful and very serious. Let us be deliberate and put a lot of actions in what we are doing when it comes to these vaccination strategies. Now we say that what vaccination is was cost effective, because with this vaccination you can be able to prevent some illness that you can be able to prevent with little money you have. Instead of waiting for it to come, then you begin to spend the main money. All right, so there's another thing of which we need to still mention on these prevention strategies, that what we call prep and PEP, which is not really a vaccination, but it's something that we need to still mention whenever we're talking about these prevention measures, right, to combat some challenges. PrEP, when we say PrEP, we mean pre-exposure prophylaxis, all right, and when we say PEP, we mean post-exposure prophylaxis. So this PrEP is very important and is recommended for special kind of people. What is PrEP? This PrEP, which is pre-exposure prophylaxis for HIV, prevent what we call HIV, human immune virus, which is capable of leading to acquired immune deficiency syndrome. All right, this particular PrEP help in protecting someone from having HIV. All right, and if someone can be taking it as prescribed, you discover that even when you have contact with anybody having HIV, it cannot be transmitted. And please take note, it's not only through sexual intercourse that this HIV can be transmitted. Even use of same needle or use of some personal equipment, right, it can still lead to this transmission. So, and it can even be transmitted through blood transfusion, especially if you go to a healthcare center where thorough blood screening is not done. All right, so which is the reason some people can still go ahead and receive this PrEP, all right, and take this PrEP. And some certain healthcare providers is highly recommended for them, especially those people that are working in the lab in healthcare center like primary healthcare center, general hospital, federal medical center. Those people working in the lab is expected to be taking this PrEP. Reason being that what any mistake can happen, right? Or which maybe someone will just maybe the needle, after extracting blood from a HIV patient, you can have a piercing of hand through this particular procedure, right, of taking blood from the patient. And when it happens in that way, before you know, you have contracted it. So with this PrEP, it will protect you from all those challenges. So it's recommended for health workers that are always in contact with the patient blood, especially those that work in the laboratory unit. So this PrEP is important. And that of post-exposure prophylaxis is also very important for people that are doing all this special work. Even healthcare providers also can giving this post-exposure prophylaxis. This one is given when you discover, for instance, a healthcare provider after having what we call occupational hazard. All right, maybe you want to inject the patient, you notice any piercing. All right, maybe the needle pierces your hand. I think the best you can do is to know the status of that particular patient, to know if the person is positive or negative of HIV. And if you cannot know if the person is positive or negative, you can still go ahead and take what we call PEP, post-exposure prophylaxis, to protect yourself adequately in case there is any issue. In case if you're having if the person is having this HIV, it will protect you from having this HIV. All right. But if you neglect it, before you know, you don't know. All right. You don't know if the person is having the HIV. You don't know if the person is not having the HIV. So it's just very important to protect yourself as a healthcare provider. Whenever you have this whenever you have this occupational hazard, it's actually important you protect yourself by taking this PEP, post-exposure prophylaxis for HIV. So it's part of the things we want to mention when it comes to this prevention strategy. So we say prevention is cheaper than cure. Whenever you see this video, please, it's actually important to share the video because with this video we have actually covered a lot of wider range of diseases that can be prevented. All right, and with these prevention strategies, you notice that what even visiting the healthcare center will be reduced. So, and we it have created awareness, which all of us will know that henceforth this is what we need to do. Henceforth, this is what we need to do. So, we have mentioned a lot of things that we can be able to do, even the one that is cost effective and the one that is free of charge. That of childhood vaccination in many health centers is free of charge. In fact, as a matter of fact, the government, in order to encourage people from in order to encourage people to take this vaccination, or to encourage parents to avail their children to receive this vaccination, they have to put some amount of money. Say anyone that is able to complete their vaccination, vaccinate their child complete, all right, from 0 to 15 months, which is 1 year, 3 months. You can be able to vaccinate your child and fill all those cards, all right, as expected. I think in some health center they'll give you 10,000, all right, for doing that. So it does all those ones a way of encouraging them so that they will be committed to this hospital visit to receive this vaccination. Let no one deceive you that vaccination have done this, vaccination have done that. As a matter of fact, no, nothing in health, right, in healthcare as a whole, that is completely safe, especially with the people that are administering it. If you put it into consideration with the people that are with the healthcare team that is administering it, this particular vaccine may be working effectively with lesser side effects or a very minimal side effect, but the person administering it may be the one at fault, and it will result to partial paralysis or even result to abscess, and we'll begin to say that it's because of the vaccine. If we have to tell ourselves the truth, life have improved, infant mortality have been reduced. These maternal complications, all right, during pregnancy have been reduced to a very large extent. All right, of course, that of pregnant women, there is their own schedule for tetanus. All right, their schedule they have within the period of pregnancy. All right, whether first, second, third, they are going to spread it within the pregnancy 5 doses of anti-tetanus vaccine to protect the mother from having tetanus. Especially this particular tetanus is very common in an unhygienic environment. All right, if they are doing delivery in an unhygienic place, it will protect the mother and even the baby, all right, in that during delivery. So it's important that every pregnant woman should take note of this and receive these tetanus anti-tetanus vaccines, 5 doses within the period. They will give one during the first period of pregnancy, the first pregnancy, right? After that, the second one, they will still continue. Make sure you are committed to the schedule and complete your immunization, all right? Complete your vaccination of this tetanus, all right, to make sure that what to protect yourself from all those issues. So this vaccination have actually helped what in improving the maternal health, all right, reducing what maternal mortality, all right. This even infant mortality have helped us what in reducing all this infant mortality and help what in improving the health of the people. There's still other one that serve what as protections, right, to both the adult and that of the child. But these ones we have mentioned, with this one, these are the major ones that can help us to protect our child and even protect us, all right, from all these challenges that we notice these days. So let us take note of them and avail our children of the opportunity to get vaccinated of these particular diseases that again this particular disease we have mentioned. It's actually important to give your child a brighter future, just like people that are having a child that is SS. I don't know the reason this keeps happening, because it's just like bringing a child to the world to come and suffer and die. All right, because there is a lot of complications as regards this SS. It's very painful when the crisis comes up. It's very is deadly. All right, it's as in, before you know, the person will be having jaundice. Before you know, the person having all this uh, all pains all over the body. Even fever can come in, and the immune system will be decreased. So is it not better you go for the necessary precautions, of which they say that AS should not marry AS should not marry SC, all right? All those things are um, the negative side of the um, um, all this blood grouping. So please take note of this. Sorry, all these genotypes, sorry. Take note of this and make sure that you follow the necessary um, guidelines that is being given to you by the healthcare practitioners. Once you are AS, all right, do not go for AS. You should be looking at what genotype that is AA. All right, it's just only AA that you can go for. All right, if you are AS. So take note of the genotype issue and make sure you sort it out with your partner before starting anything official. Very important, because if you didn't do it and give us, because if you are giving birth to any child that is SS, you are still giving to us in the world. We are still the people that are seeing it, especially that of healthcare team. Before you know, bring your child to the healthcare center, hospitalize this my child is having fever, doing all those complications can be prevented. In fact, you need to be flogged by allowing yourself and that of your partner to produce SS. There's nothing like love, that you love each other. It doesn't does not have anything to do with this particular condition. Because with this condition, you have ended up bringing a child into the world to come and suffer for nothing. And if you are to put yourself, if you are sincere enough, you have human heart, you a kind of assume being in the position of that child. You know that what the child is passing through is as in, is not something that anybody would even wish your enemy, all right, to even pass through it. So please, thank you for joining us today. We have ended up in creating this awareness, all right. So we discussed what everything to know about vaccination, right? Of course, vaccination is what the way of what taking some can be an antigen, all right, to protect your body. Antigen, which we say is an enemy that comes into the body before the body will develop what we call antibody to fight against it. So some of these vaccine can be what life attenuated, some can be even dead version of vaccine, some can be what we call messenger ribonucleic acid of that particular disease that I want to prevent. All right, so all those things, some can even be the protein. So when it is introduced into the body will now develop what immunity against it. They are developing antibodies to be able to fight it. So that's what vaccine is all about. And for those that are thinking vaccine is killing us, vaccine is a way of introducing disease into our system, is not true. Is not true. Yes, we can say it's a way of introducing that disease into the system, but don't forget life attenuated. Don't forget weakened version of the disease. All right. So, and the essence of it, this is all about biotechnology. Is sense that they're using doing it. There's nobody that we have let's say hepatitis B, that will test negative of hepatitis B, and they will give the person hepatitis B vaccine, and at the end, after let's say 4 months after the vaccination, and the person go and test and will detect hepatitis B. No, it's not possible. It's not possible. But during the, like, especially that of hepatitis B, during the 3 consecutive months that you are receiving it, if you check, you can see hepatitis B, but it doesn't mean that what you have this hepatitis B. All right, it means that what there is introduction of this antigen into your system. all right, of which you need to just become receive the full treatment, then leave it within some shortest possible period of time. When you check, you're not going to see hepatitis B, all right. And even when you come in contact with anybody that having it, you are not going to have the hepatitis B again, because you are already immunized against this hepatitis B. So please take note of this, guys. And thank you for joining us. Once you share this video anytime, any day, please do well to share this video to others. Let them benefit from this video. It's going to go a long way in helping us to grow our health and that of our children. So thank you for being part of us today. Thank you for being part of the live streaming. Do well to share this live streaming video to people or groups where you belong to that will want to benefit from this video. So see you guys tomorrow. I remain health educator Mike, and our major aim here is health promotion, disease prevention, creating of awareness to make sure that you live a healthier life, taking this healthy living to a global scale. That is our goal, that is our mission, and we are going to stick to this mission and achieve our aim. Thank you for joining us for today, and see you guys in the next live streaming tomorrow by 10 a.m. Thank you.